Well, with me right now is Dr. Christine Chung and Dr. Chuck Lee of 7 Day Dental. Got a lot to talk about. One of the main things is coming up in April is Cancer Prevention Month. I want to welcome both of you.
Thank
Great
you.
to have you here.
Good morning.
Good morning to you.
Good morning.
To you. I'll reach across there. I think a lot of people don't realize when they maybe think of cancer, of oral cancer. So let's talk about the screening process for that, but let's also talk about the prevention of it, and also how does one get oral cancer? I know sometimes you hear about people maybe who have smoked cigars or something like that, but just in general, what can be some of the causes for that?
Well, alcohol consumption, tobacco, even there's herpetic, HPV.
Okay.
And that's, from
Yeah.
oral sex.
Human papilloma
HPV.
virus, something like that.
Yes.
I know I'm pronouncing it wrong.
Yes.
So this is all what makes it very, very important, not only to keep healthy mouth in general, but how important it is to get yourself checked up for something far beyond just cleaning your teeth, right?
Mm-hmm.
Yeah, so we do regular routine checkup for patients, and we do visual oral cancer screening. However, we recommend and encourage patients to come in for the actual oral cancer screening.
Okay.
We have tools and we have materials to screen for that. It's simple, it's easy and fast, and it's very affordable, and most importantly, when there's early detection, there's always a life-saving to it.
Of course.
Yes.
Yeah.
So
A lot of times when we do this test, we're able to pick up lesions that you can't see with your naked eyes.
Okay.
Because sometimes when you can see it, it's a little late.
Right.
So it's always wise for patients at home to check, and also to come in and, especially high-risk patients, they should definitely check to see if there's, we can screen it. We have Velscope, we use Visalite, and we're able to detect through looking through it, and we're able to see lesions that we normally would not be able to see.
right.
So in a sense, you are the first line of defense, and if you find something, of course, then you turn around and work with their primary care doctor and move along to that. But you are the type of folks that are going to see that first.
Exactly.
Yeah.
Because any kind of lesions, normally it would take 5 to 7 days, or the most 2 weeks to go away. But if it persistently appear, then that's abnormal.
Right.
And when we see that, of course, we have to refer out for further evaluation or biopsy. So we're like the first doctor to be detecting those abnormal lesions in the mouth.
Yeah. So as far as just, keeping yourself, your gums, your teeth healthy, I know you've talked about, obviously, we've heard this for years and years and years, the importance of flossing. For some people, it can be a little difficult for a variety of reasons. Just for the average person, sometimes it can be difficult, but for somebody maybe they have arthritis in their hands and things like that, I know there's special flossing tools that...
Yeah, so nowadays, I started out with 2-year-old baby, and I told mom, you know what, once you have teeth, encourage them, start them early, give them a habit of flossing. So from baby to elderly, even old patients, everybody should floss at least once or twice a day. And the more you floss, you will be amazed finding out how much plaque and bacteria build up, because it only takes 24 to 48 hours for the bacteria or plaque to build up. And it gets calcified. Once it gets calcified or hardened up, there's just no way you can floss those out. So, and
Very
you want to
important.
add about flossing when you see bleeding?
A lot of patients, when they floss and they see bleeding, they think that, this is, when you get bleeding, they think, I'm irritating my gum, I'm traumatizing my gum. So a lot of times they won't floss anymore. And so flossing when there is bleeding upon flossing or even brushing, that's an early sign that, hey, something's wrong.
Yeah.
And that's the perfect time to go see the dentist to see, hey, what can we do to prevent this? Because I have a lot of patients that said, my gums bleed ever since I was born.
Right.
And they can't remember that far, but they always remember when they brush or when they floss, they rinse out, they see a little bit of trickle blood.
Yeah.
And any blood is not healthy. I mean, if we were to take a shower and all of a sudden we see some bleeding from our body, we're going to be very concerned.
Right.
But yet in our mouth, we're not concerned. And it's so easy because if the patient were to come in with just a little bleeding, I bet we could remove that. So just by a gentle cleaning.
Yeah, yeah.
But yet we wait and they don't floss further because they don't want to irritate the gum more, and then the problem gets worse.
Hey, let me ask you, you know, along the lines of that, you're out and about somewhere and you've eaten a meal, and what about, does it really help to chew gum, to chew obviously sugar-free gum? You know, for years we heard that brand and saying that, you know, it helps. Is that true?
Yes,
Okay.
it does. It helps clean your teeth too.
Yeah.
You know, and so it's a good idea to chew gum, especially xylitol gums.
Yeah.
It helps some patients as we get older. We take a lot of medicine, and that tends to dry up your mouth.
Right,
So chewing gum does promote more salivary secretion.
Okay, one more question along those lines. What about mouthwash?
Definitely.
Okay. Any kind of brand, or should you
Yeah.
go for the, you know, the Listerine type brand?
It's generic.
Yeah, it's generic.
Yeah.
Okay.
It's just the alcohol will freshen up your mouth.
Okay.
You feel fresh, but sometimes it can lead to staining, and that can be easily taken off when you go to the dentist for cleaning.
So that's yeah, I always wondered about that.
So my routine that I recommend for patients, first you should floss, because when you floss, you're able to go under the gum and loosen up the plaque or the food around it, and then brush. And after you brush, then you use a rinse.
Okay.
And that's a good sequence. And a lot of patients do the reverse.
That's a good idea.
Yeah, and they do reverse. They brush and then they floss, because when you brush away all the food or plaque around the front or back area, but then when you floss, you loosen up more of the food or plaque in between your teeth.
Yeah.
So you got to brush again.
Yeah, yes,
because
that's
it
right.
still sticks around. And then after that, it's good time to rinse. So when patients come in, if we see that they have dry mouth or any sign of dry mouth, we will recommend maybe fluoride rinse that they can do once a day on top of what.
And you would do that after
the
last step.
Yeah,
okay.
That'll be the last step.
What about the type of toothbrush to use? There's dozens of brands,
many brands out there,
and you got soft, you got hard. You've got, when it comes to the electric ones, you've got the ones that are the spin brushes, the little round ones. What are a couple between the manual, or I should say just hand one, what would you recommend with that? And then when it comes to the electric ones, what kind of shape do you want to?
I've always recommended the patients a soft one, because rather it's a technique than the tools.
Okay.
Because some patients think that if they brush vigorously, then they will remove all the plaque, but it's not necessarily true. It's the technique, it's the circular motion, and it's how you can reach all the way in the back. Because most of the plaque buildup where people miss would be in the molar areas, because they can't reach that far.
Yeah.
And I like electrical toothbrush with the circular or round, small tip, because then you can reach all the way in the back and you brush single tooth. But again, that's not replacing of a flossing. I would do both.
Okay, and
with
I
the
know
toothbrush and the flossing.
Nowadays there's even a couple companies kind of have an online service where you sign up with them, and like every 2 months or whatever it is, they automatically send you new tips for that. And I forget the name of it. It's kind of like that one company that does the shavers. It's kind of like that along those lines. You don't have to think about it. It's like every whatever it is, they send it to you, and because you've said, both of you, how important it is. You know, people tend to use toothbrushes for like a year. You know,
Oh yeah.
They don't want to part
I would
with
change
them.
out every 2 months,
Yeah,
or depends
yeah.
on.
I would.
Yeah.
I think when the bristles of the toothbrush flare
Yeah.
out too much, you're not going to be effective anymore. So I recommend, because it's so inexpensive, that we should change out. I would recommend changing out every month.
Okay.
And always use a soft one, and make sure that patients, when they brush, we should close our mouth to reach the back teeth. It's hard. It's I see as patients always miss the back teeth.
Yeah, I see. No, I see what you're saying.
Especially
yeah.
if they have wisdom teeth, they always
Yeah.
miss it because they always open their mouth to brush. They don't close,
Yeah.
because in order to reach that, you have to close your mouth
Right.
to brush.
Right.
So, but another thing is, as we get older, our manual dexterity is not as good.
Sure.
So it's always better to use a rotary. And rotary, the difference between rotary and manual is, manual toothbrush, a lot of patients brush many teeth at once. And a rotary, you have to brush single tooth. So
Yeah,
it's
that's
going to be
true.
more effective.
Okay. And again, you know, the importance of just your general cleanings and checkups, and even beyond the oral cancer, but just coming in and making sure everything's good, because it's you
Yeah.
folks are you're gonna find out a lot quicker than the patient will.
Oh yeah, because I'm sure you will miss a spot or two, and we as dentists, hygienists here for you to take care of that every 3 months, 4 months, or 6 months, give you a healthy, fresh mouth. And you know, healthy mouth will give you healthy body,
Yeah,
because
that's
oral
very true.
health is linked with your systematic health.
Yeah,
And you know, all these other diseases like diabetes,
that's true. Yeah.
Heart disease.
Heart disease, yeah, that's a big one.
The bacteria that's in our gum is circulating throughout our whole
Yeah.
body, so it affects all other parts of the body.
And I understand you folks have a special for Laguna Woods residents at your Laguna Woods location, which is right over there
Yes.
by Aldi and all those
We-
new stores.
we accept all kinds of insurance, and if you don't have insurance, for the first time you come in, we have a very special rate that includes x-ray exam and a cleaning if there's nothing more than a cleaning. If
Okay.
you don't have underlying gum disease. Free consultation if you need to see a specialist for your root canal treatment or your implant. Call us.
Okay.
We will have you come in for a free consultation.
All right, very good. We you know, all know the importance of that, and get in there and they can help you out. Specials for the Laguna Woods residents, and you know, we've known these folks for quite a long time now, and
Yes,
they do good work.
And we've been serving the community for the last almost 20 years.
Yeah.
We've seen patients coming and say, hey, Dr. Chung, I see you on TV, and I'm just so glad and so proud to be a part of it, a part of the community, giving
Well,
back the service.
We're glad that you're coming on. Good to see you folks, and we'll see you again soon. Remember, they're located right over there at the Willow Tree Center, which the best way I can say that, if you don't know where that is where the new Aldi store is. They're a few doors down, and you'll find them, and they've been there a long time. Good to see you both.
Thank you.
All right, take care.
We'll see
be
you
right
next
back.
time.